The Ultimate Men's Movement with our host, Dr. Jack Rocco. Hey, Dr. Jack, how are you today?
I'm great, Neil. How are you doing?
Doing great this Friday morning. And I'm excited about what you have a story to tell. And that's what's so great about this podcast. We're storytellers. And the story you have to tell about a patient yesterday, I can't wait to hear about it.
Yeah, and I think it's a story of why I'm doing what I'm doing. The health, the wellness clinic, getting out of the basic rat race of medical illness care. Instead of illness care, we're working on wellness care. And we had a patient yesterday that I think epitomizes that in so many ways. So he comes in 80 something, okay? He just recently underwent a 3-level back fusion for lumbar stenosis. And he said this was the first time in 6 weeks or so that he's been out of the house.
Oh my goodness.
And his wife set it up for him to come because same thing, like energy, but also he's been on testosterone for years. And he really attributed it to his success in business. He owns a boating company that builds these massive sailboats that the rich and famous buy and sell. And he's been on trips taking these boats to people, delivering them all over the world. So he's a really impressive guy. But I said he's been on testosterone and he attributes it to that. He said the last 3 years, he's just with his spine issues, he's really had a decline. And he wasn't sure that his testosterone, he's been getting the testosterone, but he's not sure that it's been therapeutic for him. So we sat down, and he's otherwise fairly healthy. But I love it when patients take control of their own health. And I said between him and his wife, they sought treatment. So we started talking about his medicines. We converted him to the cream he was on the injectable testosterone. And when I talked to him about it, I'm like, do you like that? He's like, I don't know. I said, if I could give you a cream and you wouldn't have to worry about the needles, would you prefer that? And he's, oh yeah, absolutely. And we're getting the same levels, and we get the same levels with the cream as you would with the injectables, minus the needles, minus the disposal, minus the added expense, and just having to keep it refrigerated. So many things with the injectable that just make it inconvenient. So anyway, so he was right back on par with that. But like I said, I love that I could sit and have a conversation with the guy and get to know him, get to understand him. That's the best way to know your patients. And I grew up with that kind of mentality. I always knew my patients. My friends were my patients were my friends. And I can't tell you how many patients I've had in my house because they either were friends to begin with or became friends afterwards. And I love that relationship. And I think that's a true, genuine community relationship when it's not doctor-patient, it's man-man, it's man-woman, it's human to human. And I just happen to be their physician. I'm sure they have a bank, a financial planner. They've got a baker, a car repairman. And I see no reason why you can't have relationships. But that's when, the true care comes out. The way healthcare has gone, we've all seen it, and no one likes it. No one likes that the physicians are rushed. The physicians don't like that they're rushed. The patients don't like that the physician's on the computer 24/7. As soon as you walk in, they're looking at the computer. Even with kids, pediatrics. You got a little kid there, and they're looking at the back of the doctor's head and expected to have faith and trust in this person. Are they even paying attention to me, what I'm saying?
No.
And then the amount of time we need to spend doing the billing, the collecting, the transcribing. We've been turned into technicians as opposed to physicians. And I said, in the wellness clinic, I have the time. I'm not scheduling 15-minute appointments. We're scheduling 45-minute, half hour at least, whatever they need. So I really like that about the arrangement that we have.
And it's nice because you really get to have that patient-doctor care, which is so important to see the growth. If you can't have that time to be with them and it's so fast and rushed, and you're just seeing numbers, you're really not able to build relationships and have them give you their true health trust. Because a lot of times when people go to a doctor, they don't tell the doctor really what's happening.
No, absolutely not. And I learned that very early in my career. I try not to be pretentious or talk down to people. I grew up in a blue collar family. My friends are regular guys. I'm not hanging out with the elites of the world, but I love that relationship. I love coming from that background. Like, those are my patients. Those are my people. And everywhere I've been, I've always had good relationships with my patients. And that's when you really care. That's when you really understand what's going on. Because it's hard in 15 minutes when 8 of those minutes or whatever is spent on the computer. So it's completely just distracting when you're constantly looking at the computer, when you're doing all the check boxing on a day-to-day basis. But this is just the time, just me and him, what's going on. And the other thing that he said, that he was looking at one of our videos. His wife pulled it up online or through the website, whatever. And she's like, you got to come listen to this guy, because he's an orthopedic surgeon. And this guy's got, like I said, he just had a 3-level back fusion, and he's doing the meds clinic. So I think it's a really diverse and needed combination for men.
Yeah.
And the other thing, like I said, there were so many things about his visit yesterday that just made it stand out as ideal. He came in and he told me his wife made the appointment. And sometimes I like it when the man and woman come in together and they're talking about their sexual wellness, or they're talking about whatever, the man's health, because guys will sometimes, I don't want to say lie, but downplay it. And I've been in that situation where guys like, how's your shoulder? That's not so bad. And then the wife chimes, like, what do you mean? You're up tossing and turning all night. But anyways, he wanted the privacy. They've been married for 60 some years, and he wanted the privacy, and he felt comfortable having a discussion about sexual function, about health, about wellness, man to man, physician to patient, whatever you want to call it. But it was a real relationship, and he got to have his private time. And we talked about boating. We talked about so many other things. We talked about our kids. My kids always come up in the conversation with patients, for them to get to know me to get to know them. And he's like, Doc, I'm going to bring you my X-rays. I want you to look at my spine. And I've done spine surgery for a good deal of my career, but it's not something I currently do. But I will know who to send him to, and that's to be able to accurately assess with an orthopedic eye his musculoskeletal issues, and then to be able to know where to send him for the proper treatment is priceless a lot of times. And I don't have a dog in the fight as far as we don't take insurances, so we're not bound by their regulations and their rules and their procedures, and I don't have to get approval for it. I just can make a referral where it's need be. Then they may have to deal with their insurance, but I like that autonomy. Like I said, I don't have a dog in this fight. I can give him an honest opinion. I'm not earning income based off doing surgery on him. We're there for our purpose, but we can provide a lot of other services. And I talked to him about, he was a very intelligent guy. And like I said, very proactive. And we talked about the P-Wave device, and we've had that discussion, where the P-Wave uses an ultrasonic wave to break up the plaques in the arteries, which provide blood supply to the penis. And he immediately is, oh yeah, a buddy of mine gets that for his kidney stone. So I'm like, yeah, exactly. And that's, with the kidney stones, they call it lithotripsy, but it's a very standard way to break up those hard plaques that are in the arteries or in your kidneys or wherever they are in your bladder. Just had a great conversation. He was very pleased. I'm going to bring my wife the next time. So it's
good.
Yeah.
And it's interesting because you bring a diverse background compared to some other doctors. And especially for men need to know these things. As a surgeon, you have a different mindset than a basic practitioner. That's the difference. And a lot of times we're not meeting the doctor anymore, our PCP, we're meeting a nurse practitioner. We're not even having the opportunity to have a conversation with a doctor anymore. You bring those years of knowledge, plus you also bring being a man, and it really has a great fit for sure.
Yeah. And that's, like I said, we talk, I can speak to him however he wants to speak. You know what I mean? If you want to talk like a sailor, I'm okay talking like a sailor. I've known plenty of sailors. On this side, this guy's a crusty boat maker up in the Narragansett Bay, and just so many things about him I really found interesting and enjoyable.
100%.
And from a work, they always talk about work-life balance and all of these corporate phrases that are supposed to make you feel good. Just If you're stressed at work, go home and have some lavender aromatherapy. I said, I don't need lavender aromatherapy. I just need a good experience at work where I can have a communal relationship and conversation with a patient and enjoy it. There's the pay right there. We all need our businesses afloat and pay our staff and have some left over for you. But if you're drudging every day, when I was in Pittsburgh, it started to get like that, where or Altoona, but close to Pittsburgh, it was getting like that. The big corporate behemoth comes in, and suddenly all the stuff you've been doing for, at that point, it was probably 25 years I'd been in practice. I know what I'm doing. I get good results. My patients come back to me. My office is always packed. And now you're going to tell me how to do my job, which most of it was taking me away from my job.
And what's the good news is that it's probably healthcare is going this way. More and more people are going to see the cash pays the way. Why are we paying for health insurance? I'm telling you, this is coming.
I agree.
But best to have the least amount of health insurance and high deductible and get an FSA or HSA and focus on, and then choose, especially for HSA, to go where you want to go. Mm-hmm. Go to where you go. Pay for, if you get the right treatment, you're not going to need as much treatment. Yeah. And I wish I knew this when I was younger, how important, I probably wouldn't have cared, but I wish I would have known this when I was younger, how important it is to find good health care, not sick care.
Yeah. And they put you in protocols. It's not really designed for, the system is designed to maximize profit. And I said, I've been sitting at the board tables. I've been in the high level with hospital administrators. And it's about put through. It's about how do you get these patients through the fastest? If they need an MRI, you got to send them to our MRI place. If they need blood work, you got to send them to our blood work place. So there's so much where, and then if you get into it, like CVS owns Aetna, owns the prescription management plans. So they're taking their money from one hand and paying it to themselves and then paying it back to themselves and back to themselves and back to themselves. It's this contained system, which is supposed to provide efficiency of scale and reduce costs. When has that happened? Where is the cost savings for all this integration and all this consolidation? That was always, for, like I said, go back 10, 15, 20, 30 years. Oh, if we consolidate all this, we're eliminating all the waste and fraud and blah, blah.
Yeah.
And we've turned it into a monopolized system where you've got a handful of insurers who also own the hospitals. And I said that when I was in Altoona. We were taken over by UPMC. And okay, what is UPMC? Is UPMC a hospital that also provides an insurance option, or is an insurance company that owns a hospital? And when the insurance company owns the hospital,
they choose what to do.
They own the physicians, they own all the ancillary care. It should be cheaper. They're profiting hugely. All these, and it's not just UPMC. It's all
every city, every big city, even small city has one that's controlling this and then controlling the narrative. Instead of opening up insurance for a competitive game like life insurance or other types of insurance, why don't we do that and eliminate state by state borders and healthcare, and that can change it. But we had to have that conversation at one point because it's going to get too expensive. One of my clients, Claim Links, talked about that there is that a company is covering a group family plan for $5,200 a month. That is unreal. And the company pays $2,500 of that, and the employee pays $2,700.
That's insane.
That's insane. That's a very big outlier, but that's the point. And did you know that they came up with the idea based on deductibles? What the average deductible, there's an interesting thing on the website as well. I can't quote it, but basically out of 100 patients, only 10 reach the deductible for $5,000, and only 20 reach the deductible for $500. Some people. Yeah. So it absolutely.
They know that in advance. They have all those actuary tables. That's known information. That's why they plan it that way. And I've said that between what you pay for in your premiums, your premiums are expensive, your deductible's expensive, and most people don't go to the doctor.
No.
And I've seen this through my whole practice. There's a percentage of your practice, a large percentage, that are frequent flyers. And same thing with the emergency room. There's a percentage of patients that are frequently, anytime you work in an emergency room, you get to know those patients. They come in because they overdose. They come in because they've got ulcers where they shoot up their heroin. They come in at 3 a.m. after they've been to the bars for a Tylenol. And they don't have Tylenol. They know they're going to have a headache in the morning because they've been out drinking all night. I can't make this stuff up. Can't make this stuff up. So they come to the emergency room on their way home from the bar. They stop in the emergency room because they've got a headache and they want a Tylenol. Literally, this was really frequently. So anyways, so the vast majority of healthcare is utilized by a small segment of the population. And the regular people who pay for their insurance, who pay for all this stuff, rarely go to the doctor. I can't tell you the last time. I went to the doctor when I was having my flare-up I had a rheumatologic flare-up from the COVID vaccine.
Yeah.
And that was 4 years ago. That's the last time I've been to a doctor. And I know doctors, my experience is probably a little different. But the point is that your average person is not spending time in the hospital, in a physician's office.
No.
There's those frequent flyers that frequently use it, but they don't have high deductible plans. The people with high deductible plans don't go to the doctor. They're proactive, they're preventative. So it's a system that's
completely broken.
It capitalizes off those dynamics and off the logistics of it to maximize profit. And I said, but it's like the insurance company owns the hospital, owns the physician practices. You're not seeing a physician. The physician is co-signing on 2 or 3 other nurse practitioners or PAs. He's not seeing those patients. He's not reading all those notes.
No.
And I can make a mistake. That's if you're not humble in this business, it doesn't matter who you are. There's always human error. You can't be all-knowing. You can't have the answer for everything. You play the odds. And that's where experience comes, is that you lower your odds so that your odds are within a reasonable range. And if your odds, but you also don't have it isn't like you have one chance to get the diagnosis correct.
No, not at all.
Here's an 80% bet. Okay, here's an 80% bet. I'll take that bet every day. So you come in, you tell me your problem. Okay. It could be a list of 1,000 things, which is what you'll find on the internet or AI. It could be, I've got nausea, I've got malaise, I've got brain fog. You could have 100 diagnoses. Okay, it's flu season. You got a sniffle. Your spouse had a flu. It's likely the flu. Let's go with flu. So you play those odds. This is the physician mindset. Let's try this and come back in 2 weeks and we'll see. Oh, no, doc, it's getting worse. Okay, if it's not the flu, what's the next tier? What's the next tier?
Yeah, and so how much do you remember from medical school, and especially if you specialize in one thing, to look it up? It's very helpful what is involved now with AI, but also with research. You can figure all that research out, but you just have to be an investigative. But that's why the specialist. Go ahead.
Yeah, AI is certainly useful for a plethora of information, but when you get information overload, if you're Tom Brady, you know who's open, who's likely to be open. You know the coverage, and you go with your high return. That's life. If you're an investor, you know that it's a cyclical market, and you know that commodities are going to be coming back. You play your odds with most things in life. But like I said, if you're supervising 2 or 3 nurse practitioners or physician's assistants who knows what their experience is, who knows what school they went to, what hospitals they trained at, it's very hard for you to supervise all those people. And I said, I can make a mistake. They certainly can make an error.
No doubt.
They have less experience. They have less training. They didn't go through the same weed out process. And but people, everyone can look up AI. But what are you going to do with that information? People bring me their reports all the time. And they're like, oh, it says this and this. And what are all these words? It sounds you've got to,
because they don't know how to prompt. You got to give. So if for AI to be good or whatever to be good, you have to understand and you have to know your knowledge. You have to read background information on your diagnoses. You have to read extra background information. And then you got to also monitor your body and then feel like what are the symptoms, what's happening, and all these different things. And then ask the professional and then get multiple professionals' advice, because you're right. Some things are really simple to identify. Other things are much more difficult.
yeah. And I always say that about MRIs. If you come in with an MRI, if you're over 40, 50, and you get an MRI, you have no symptoms. We take 100 normal people and you run them through the MRI scanner. 40, 50, 60% of them are going to show a tear, quote unquote. And I would say, people, if you have gray hair, wrinkles, and a spare tire around your belly, you have tears. Your body has got 40 years of experience and injury and recovery, and everybody's got quote unquote small tears. I said, do you want surgery? Oh, no, it's not that bad. Then it's not a tear. It's fraying, it's wear. But I said people will come in and the x-ray report will say tear of the supraspinatus, tear of the infraspinatus, small tear of the teres minor, degenerative changes within the glenoid, tearing of the labrum. You're like, holy cow, my whole shoulder's falling apart. That could be anyone. But it's knowing at what point do you cross over from you got a sore shoulder to you have a surgical shoulder? And that information is best determined by a surgeon who's been in, who's honest, who isn't making money off of doing procedures. He's making money off of being trusted and treating patients and having good outcomes. And it gets complicated, but it's not that easy. But anyway, so the bottom line is with the wellness clinic, I'm able to take all my illness information and my years of experience and just thousands and thousands of patients and relationships with other specialists. And we can gear you towards where you need to go quickly and efficiently without a conflict of interest, without all this rules and regulations. I can just tell you like it is. And that's a huge convenience. It's a huge efficiency. And I think you're right. I think at some point, the groundswell of frustration and, okay, show me the savings that you've been telling me about. Show me the savings, because every year it goes up and every year everyone's salaries go down. But the executives and the stock prices continue to go up. Show 100%. Me the savings. At some point, someone's going to call them out on this or realize that, you know what, instead of spending $2,500 a month on my insurance, why don't I go see a doctor who knows what they're doing?
Right.
Can prevent these problems from occurring, can stop them from happening. There's your answer right there. My grandfather, the old phrase, an ounce of prevention is worth more than a pound of cure, Ben Franklin.
Yeah.
My grandfather had a little twist on it. It was like, Jack, he's the Italian guy, always with the hands. He was like, Jack, what they say, an ounce of prevention is worth more than a pound of cheese.
All right. Okay.
I don't think it was cheese. Right. I think it's something else. But anyway.
All right. People can schedule a call with you very easily by going we got to get movement.com. We got to create that. theultimatemensclinic.com. It's in New Bedford, Massachusetts. You do virtual appointments, so people need to get testosterone or certain things. You'll be able to work with them. So go to theultimatemensmovement.com, theultimatemensclinic.com, and you can subscribe to the Ultimate Men's Movement. Appreciate it, Dr. Jack.
Thank you, Neil. Always a pleasure.
All right, that was a special simulcast of the Neil Haley Show and the Ultimate Men's Movement, guys. Take care.
Thank you.
Hold on, let's go. Boom.